You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And our topic today is pain, the chronic kind of pain. We have Dr. Kumar and Monica with us. Thank you. You're from the Magruder Pain Clinic. And there's lots of different pain. I was raking yesterday, so I'm probably going to have some pain, I think, in my arms and my shoulders today. But what kind of pain are you guys talking about when you deal with pain management?
Well, we deal in all types of pain. There are two general categories of pain. One is, without getting too nerdy on it, is nociceptive pain. This is the pain that all of us are used to. You will see that whether if you broke a leg, if you've twisted your ankle, went out over to the yard, did a weekend warrioring. This is the pain that almost every one of us has, and that's basically called a neuropathic, nociceptive pain. Then there is another pain, which is called a neuropathic pain. Okay. Those pains are a little bit harder to treat, and those will be the pain that you get from shingles, from diabetes, from a nerve injury itself. Okay. And so those are the two generalized category or baskets of pain. Each one of them gets treated differently depending on the cause, the duration of what the problem may lay.
Okay. So I wouldn't necessarily need to come see a pain management specialist because I have pain in my arm from raking, because it's going to probably, hopefully, go away.
Correct, correct. And the thing on there is our body has tremendous recuperative powers. So generally, if something doesn't go away, generally resting it, warmth to get the blood flowing there, working with non-steroidals over-the-counter anti-inflammatory medications, and if it still persists, to be seen by the family doctor.
Okay. And you mentioned a couple of conditions that sort of lead to this more sort of chronic pain. Diabetes, shingles. Are there other kinds of situations that people experience pain that end up coming to see?
Oh, absolutely. I mean, you'd be hard pressed to think of a person who doesn't have pain. Basically, the process of aging in itself creates pain, whether we are having back pain from aging or damages or injuries. So age-related pains are also there. The arthritis, the arthritides. Majority of the pain we see, starting at the neck, we'll get frequent headaches, people with headaches. Again, we can find the cause of it, look to treat it, neck pain, shoulder pain, and we can go all the way down, back pain, leg pain.
Okay. And is it pretty prevalent? I mean, everybody's aging. Everybody probably has some kind of health condition or another. How prevalent is pain? Well, of any sort?
It is very prevalent. As a matter of fact, one of the stats that I have here with me today, in the U.S., we've got about 13 million people who suffer from cancer, compared to 24 million that have diabetes. 26 million that have diabetes, 24 million that have heart disease. Okay. So if you're taking a look at those numbers, now if you consider people with pain, it's more than 100 million. So it's combined, all of them combined plus is the amount of
people that have pain.
Yeah, because pain is a natural part of life. Pain is basically our body's idiot signal saying something is amiss, I need to pay attention,
hey, you.
I need to take care of it, in that manner.
Do you find that, because probably somebody else who went out and raked might have pain but aren't as much of a wimp as I am, so is it kind of like everybody has a different sort of tolerance to pain, and some people can handle some kinds of pain that other people would be just laid out with?
Absolutely. And I think that starts out with the type of condition you're in. So you definitely have tolerance. Tolerance also, there are studies done internationally which shows ethnicities, different ethnicities having different tolerance levels. So part of the process becomes, if a person has a general lower tolerance, it's more important, more imperative for that person to maintain a better condition.
Okay.
So the weekend warrioring, it's going to be rougher on them if they're not in as good a condition.
Okay, gotcha. And so when should somebody, I mean, I suppose people go to their family doctors, is it an insurance thing? Do they need a referral to come see a pain management physician?
I think it's best medicine to be seen on a referral basis.
Okay.
And the reason being is the family doctor is basically the conductor of the orchestra. So you need the family doctor to know who the patients are seeing to make sure that there is no conflicting information or data.
Okay.
So I think that's the best way to do it. And then majority of the time they are able, because you just need a little tincture of time along with a little guidance that usually resolves it.
Okay.
When the problems don't resolve, and if it's been lingering for 3+ months,
Okay.
then you call in the specialist.
Okay. So there's other things you can try. What are some of the treatment options out there for pain? And I'm sure pain probably ranges,
It's a gamut.
neck pain to numbness in just the whole thing. But what are some of the treatments out there?
Well, I mean, we can talk about things as simple as physical therapy.
Sure.
We can talk about massotherapy, which I believe very heavily on tissue mobilization. People do reach out to acupuncture, acupressure. They have their plus minuses. Nowadays science has progressed beyond that, I believe, but there are people who do find that to be helpful. Of course, the anti-inflammatories, they're the first line of defense.
Okay. And what are are you allowed to say a brand name, like acetaminophen or?
Yeah, I mean, you can say brand names. I mean, it's Advil, Aleve, Motrin. These are the common names. If we start using scientific name, people are like, huh?
What?
And I think one of the key things that has been shown nowadays is nutrition. How nutrition plays such a significant role in, one, preventing an injury from happening.
Sure.
Number two, in helping it heal. So we are very focused on that aspect also, and fortunately we have cheating methods, so we can cheat and jumpstart things. Would you not say, Monica?
I would. We do.
So when somebody comes in, I know one of the things you like to do is kind of an interdisciplinary approach or kind of a holistic approach, like looking at the person, even down to nutrition. That's not necessarily something I would think. Talk more about that, like just your fruits and vegetables, or?
Well, no, I think one can go purely on produce, but the biggest problem with that is the inconsistency in the quality of the produce.
Okay.
So you don't know whether it's grown organically and or in natural and or it's been pesticide the hell off, and you are not getting the nutrient value.
Sure.
Even though you ate a tomato.
Right.
So a tomato by any other name is a tomato or a tomato. So then therefore the best way nowadays we find, especially with the GMO foods, genetically modified foods, etc. The recommendations basically are, just go straight to the vitamins, ensure that the vitamins are being able to do a nice coverage. And nowadays, our food process has gone so much in line where what we used to get, the minerals that the food products would have in the past are not there. And things that are there, we've either osmosis it out and or ionized it out and or pasteurized the hell out of it.
Okay. So that's just one part of it. And does it have a lot to do with, when you sit down, or what is the process when somebody comes in to sit down with a plan? I'm assuming it has a lot to do with what their function and what they want to do, their quality of life. So if somebody is like a real go-getter, very active, is the goal to kind of get them back to that and look at all these different things that might play a part in that?
Absolutely. I mean, I think to gain the confidence of the person, first you address the problem the person has. Then From there, you then get into possible causes that may have caused that person to have that problem. Next, you would get into, well, what can you do to avoid people like me?
Right.
And so then we get into the preventative aspect.
Okay.
So the thing on there is, so we don't bombard them with a whole hell of a lot of data right up front. First is just touch the pain, make the pain better.
Right.
Then they will gain the confidence that you do know what you're talking about, and then they are more receptive to information, to data, and once you get them feeling better, they want to be better.
Right.
If you're feeling bad, it doesn't matter
Don't
what you
tell
say.
me to eat a vegetable.
Exactly.
Just make me feel better.
So it's a matter of, timing it,
Okay.
the appropriateness of the comments.
And you talked about physical therapy, massage, kind of over-the-counter medications. Is there sort of you start with physical therapy and you work all the way through, and if not, you try different tricks in your bag all the way up to surgery?
Yes. I mean, the thing on there is, first and foremost, depending on the injury again, generally start out with rest and an anti-inflammatory,
Okay.
a muscle relaxant if you need. If that in itself is not moving you along, then you go ramp up to something like a physical therapy,
Okay.
just to be able to make sure you're not damaging anything further.
Okay.
I mean, by that time, if you need an X-ray, it's generally done,
Sure.
by the family physician. And we encourage people to work with the family physician most, because they will not overshoot or overdo.
Okay.
And then somebody is watching what is happening in the physical therapy. Nowadays, the insurance companies, unfortunately, have stepped in and started making things requirement, which unfortunately, in my opinion, is not the wisest
Yeah.
methodology, but they're trying to do one shoe fits all.
Streamline everything, yeah.
Yeah.
Okay. So you kind of progress along, and as things don't work, what's the process when they call the office? Is there a certain set of appointments that they have? Are they going to come in for 4 appointments, or just?
Well, when they call the office, we set them up with a new patient appointment. They'll come in for the new patient appointment. Dr. Kumar, the nurse, will bring them back for their assessment.
Okay.
We'll assess them, and then Dr. Kumar will see them. He will, come up with a care plan,
Okay.
whether that be, physical therapy, X-rays, anti-inflammatories, a round of injections, trigger point injections, those sort of things.
Okay.
We'll set those things up, maybe their next appointment, and then after that we'll go with a follow-up appointment, and then
See how they're doing.
from
Okay.
the follow-up appointment.
And then at some point, they're kind of, if they're feeling better, they're cleared, and if it comes back, they just come in for another appointment to
Correct.
see what to
Yep.
do next.
The thing on there is, I think the team working as a unit is extremely, extremely important. We monitor nowadays, especially with the different crises that are on our hand with the narcotics, etc. As a team, we monitor the medications. We want to make sure there's no cross-reaction of medications and or additive effects on sedations, etc., with different medications.
Okay.
So we try to, again, take a look at the patient and try to get the patient where they need to be in the quickest manner possible with the least amount of pharmacology.
Okay. Excellent segue into the medication aspect of this. We are going to take a quick break, and we will be right back. With Dr. Kumar and Monica talking about pain management. So we're talking about pain that kind of persists, and it has a whole host of reasons. A variety of different treatment options that are out there, and we just started to broach the subject of pain medications. And that, it can start out with over-the-counter medications, just your typical Advil, that kind of stuff. But it can progress to stronger medications over time. Talk about that progression.
Sure. Basically, when a person comes to see us for pain, they've generally had pain for about 3 months.
Okay.
So by that time, they've taken the non-steroidal anti-inflammatories. They've taken whether it be Advil, Aleve, Motrin, aspirin, naproxen, the whole plethora of those. Then they've taken Tylenol. Tylenol is an analgesic, doesn't really take the pain. By that time, they've also generally applied some kind of ointment to that area, whether it be Bengay, Vicks Vapor Rub works well, to these areas. If all of those haven't sufficed, then they're basically being ramped up to us.
Okay.
Generally, they've already started a low-dose narcotic at that time. One of the advantages that we have in our pain practice is that we're interventionalist, meaning that we can put medicine any place in the body, and by putting the medicine right at the location of the problem, we can minimize the whole side effect,
Right.
avoid the whole issues of addiction and cross-reaction with other medications,
Okay.
and really just cut out the middleman, put the medicine where the problem is, get the hell out and let the area heal. We do this all the way from inside of the brain, where we've got people with horrendous migraines, to the neck area, to the back, low back, and into the feet, etc. So the thing on there is our focus is to avoid or minimize the amount of medication, pharmacy that a person needs. Because you have to remember, if the person is requiring that, that means that idiot signal is still going on.
Something's wrong.
That something is wrong. So we need to keep our focus on what is going wrong and why is it and what can we do to improve this.
Okay.
And this maybe again then gets back to getting them on a calcium diet, getting them on a calcium supplement, getting them on a medicine called bisphosphonates, which densifies the bone.
Okay.
So then the body can repair itself. The body is a tremendous repairing, it's a horrendous piece of machinery. It's such a beautiful piece of machinery, and it has a lot of regenerative powers. All you have to do is give it time, and at times, by controlling the inflammation,
Okay.
look to do this. There are other procedures we do where a person may have arthritis and a nerve is particularly pinched. We can identify that nerve. We do this under fluoroscopy, underneath an X-ray machine, and using microwaves through a needle, radio waves through a needle, we can actually trim that one nerve, that portion of the one nerve that is getting affected, and thereby eliminate the pain.
Okay.
Which then lets the body go back to a norm and allow it to heal,
To heal. Okay.
and recoup.
Cortisone, do you do cortisone? I've heard of
Yep.
that.
Yeah,
I can
no.
tell. I know just enough to be dangerous. I say that all the time.
Oh, me too.
So that's something else that you can do to kind of relieve pain?
Cortisone is one of the world. It is the gold standard when it comes to anti-inflammatory.
Okay.
Cortisone in and of itself, if you compare any other anti-inflammatory, cortisone by and far, just hands above all, is the best inflammatory.
Okay.
And without cortisone, our body produces cortisone. Without cortisone, we would be dead.
Gotcha.
So it is it is that essential
Okay.
in the healing
Okay.
process.
And nobody really needs to be, anybody watching the show or myself, we don't need to be the experts in, well, I think I need this or I think I need that. All we need to know is, I've had this pain, I've tried this, it's impacting my quality of life, and then we come to you guys and you help us figure out what needs to be done.
Right. The thing on there is, we participate in your wellness. And in the initial phase, you leave the driving to us, but then we basically get you to the point where now you're driving your own body. And at the end of the day, you don't want to be attached to a physician.
Sure.
So we
Right.
try to give the people as much autonomy as we can. But initially, we just take over the steering wheel, get
Okay.
it under control, get it to the
Right.
point where the person is understanding, modifying, and then
moving on.
progressing.
And is it different for all people? I've kind of heard that it is, that certain procedures or medications work like a charm. Sometimes you have to try it twice. It's, every human body is dramatically different.
Yes, and no. You know, everybody's body is different, and majority of the time, I think it also becomes having realistic expectations. People who think, well, I'm not 16. Well, you'll never be 16 again. You know, you're 58. You know, so having realistic expectations of what it should be, and then again, you know, one does have to look at, you know, are there other causes that a person is saying they're in pain, but what they're actually talking is suffering from a standpoint of whether it be sociological, familial, you know, psychological,
okay.
What is that? So you have to take that suffering and pain and make them into two separate items, and then you can treat either of them rather straightforward, simply.
Kind of like breaking out the nutrition part. The psychological part might have some.
Correct.
Interesting. That's why you guys are the experts. Now we started to talk a little bit about narcotics, and you know there's a you know a crisis out there with opioids. How does somebody get into trouble with all that?
I think it's just like anything. Anything in excess creates problem. I think with opioids, the same thing as even if you're going to have a drink. Again, moderation. In pain medicine, you've got to remember our body produces its own pain hormones. And if we take it externally, meaning we take it from outside, our body stops making its own endorphins and kephalins.
Okay.
So when it stops making its own, you start now becoming dependent. So think of it just like a diabetic. A diabetic, they stop making insulin. So now they need the insulin to maintain their sugar. So now all of a sudden you need that narcotic. Now what happens is your body cannot respond to the different stimuluses. So you can only take a narcotic in a plateau manner. But when you need more, it doesn't produce more because its machines have shut down.
Gotcha.
So then that is how we end up getting into dependency.
Okay.
And dependency, escalation, and then eventually into addiction and problems, and then the sociological problems with it.
Do you find that people kind of just want the pain medication, just give me a pain medicine, you know, give me a pill and make it go away, whether it's my
I think
headache or...
Yeah, I mean, I think in all of us in our life would love to have something as magical as that,
Right.
You know, but the thing on there is we don't find a lot of people like that. We do find people who are drug seeking, but majority of our patients, they just are life seeking. They just want to get back to life,
Right.
and they're just looking for help. So I think we take the approach, Monica is very particular on this, in that we take the approach that everybody is just looking for an opportunity and have come to us for our expertise just so that they can get back to life. And I think to us, the quality of life, we hound on it. You know, it is of paramount importance because you may be feeling good, but if your quality of life, you know, is really poor, I mean, you haven't gained.
Right, right.
So you do have those patients, but I think that those patients don't define majority of the population, which you have to remember, since man has had problem. And therefore, even in the Hippocratic Oath, it is to help suffering.
Right. And I also think there's probably an equal or more higher number of people out there who are so afraid of opioids and different things like that, that they're like, oh no, under no I don't even want to try it. Do you see that as well? I mean, I know a couple myself that are like, no way.
We do. We have those few, not just few. We do have those patients that are totally against. They'll say, you know, I don't want any opioids. You know, I don't want any sort of pain meds. You know, I absolutely don't want anything like that.
And for them, we work with topicals. We will create Fisher Drug, their local pharmacy in this region. They compound medications for us, you know, and so we say, okay, we can respect that, and there's absolutely nothing wrong with it, because I think we have enough tools in the tool chest that is not the only way.
Gotcha. And if somebody is on a medication, are they on it they're not on it forever, an opioid of some sort for pain, or hopefully or theoretically they're not on it forever. And is that kind of when people start to have, when you're not prescribed it anymore or you don't get it anymore, then is that where people are seeking heroin, which can be laced with God only knows what?
Right. I think that is a great excuse. I think it's used as an excuse for going into heroin. I don't believe majority of it is secondary to untreated problem, because nowadays, I mean, the hospital here does a magnificent job in being able to bring access to everyone. And you know, being a pain guy, I can tell you, you know, I'm like a bulldog when it comes to pain. I will take a bite out of it. End of subject. So to me, the heroin and heroin epidemics and everything else, those may become, the person may have started out with something like this and become a gateway drug, and or it is again the misuse of an instrument that is creating it. I mean, I can kill you with sugar, I can kill you with water, I can kill you with salt. It is, how much did I give you?
Right.
So the same thing. So the heroin is an escapism that is a totally sociological, a suffering issue, as opposed to a pain issue.
Gotcha. And talking about misuse, I just want to give a little commercial to the medication take-back locations, because if somebody is on it and they're, you know, and their pain is under control, they don't necessarily want to keep those things around, because there are people out there who are seeking, who are misusing. So what can they do with those medications once they're done with them?
You know, there are safe deposit sites. There are four in this local area. They're generally with the police department, where it doesn't matter what medicine you're talking about. You cannot say, oh, this is only aspirin and I'm just going to throw it. You know, somehow or another it's going to get to our fish. Okay? We don't need the fish any higher than they already are. So recommendation is take those pills, take it to a proper disposal site, generally with the police department or the sheriff department. They also have one at Fisher Drug in Sandusky, Ohio, and they will dispose of it in the correct manner.
Get it off. Get it out of the way. Don't even let anybody be tempted.
Clean up the house. Clean up the house. A lot of these things are just sitting there, and you have to remember that after a certain time, that is toxic stuff, you know. And why have it there if it's not needed there?
Right.
Okay. So safely dispose.
Awesome. Thank you very much. Thank you,
Pleasure.
Monica.
You're welcome. Thank you.
We're going to take another break, and we'll be right back. I want to thank Dr. Kumar Monica for being our guest today. A lot to think about when thinking about chronic pain, basically affecting your quality of life. Talk to somebody about it. Talk to your physician. Seek a professional. Very, very important. If you have questions, if you feel like you maybe need an appointment or something, you can reach the pain management office here behind Magruder at 419-732-3972. So again, great information today. If you ever have feedback about a program or a suggestion for a future episode, let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can email Mrs. Pelz at the high school, CPELZ, at pccsd-k12.net. So again, think about something you learned today, whether it's important for you or somebody that you know and love. Share that information. And until we meet again, I encourage you to make time for health.